The Uganda Oncology Crisis Elimination Expert Advisory Committee today held its 17th meeting in Kampala to assess the program's progress towards the elimination of oncology crisis, also known as river blindness, in the affected areas of the country. Oncology crisis is a paralytic disease transmitted by the bites of the female black flies that bleed in the fast-flowing rivers. It is a neglected tropical disease that causes severe itching, skin lesions, eyesight, and eventually, if not treated, can lead to permanent blindness.
On behalf of the government of the Republic of Uganda, I want to welcome you. It's really a pleasure to host many people and to host you on this occasion when we are fighting river blindness in our country.
At its peak, river blindness, a neglected tropical disease, is spread across the 48 districts in Uganda, affecting approximately 9 million of the population, putting the people at risk. The transmission of the disease in some areas has been prevented. However, there is need for more preventive measures.
River blindness was endemic in 17 focus areas. These 17 focus areas are comprised of 48 districts. Currently, 15 foci have eliminated transmission of the disease. And 2, we term them as having interrupted or suspected to have interrupted transmission of the disease. So here, the program presents the progress of every aspect of the program.
Despite an improvement being cited in some areas, the government is still carrying out preventive measures, including treatment twice a year to ensure controlled widespread of the disease.
The interventions for the river blindness disease is mass treatment. We have been treating communities in areas where the disease is using a medicine called ivermectin, and this is donated by the Medicine Donation Program. So the prevention, it's not like a vaccine, but the area which has the disease, we treat everybody according to World Health Organization guidelines. That is everybody who is 5 years and above. So to prevent it is to make sure if you are living in an area that has these black flies and you are exposed to their bites, is to ensure that you get treatment.
The national coordinator is hopeful that at the end of the 2-day meeting, the technical team in charge will be able to advise the Ministry of Health on how to fully combat the transmission of the river blindness.
So as we get along with the program, treating the people, in some areas we also put a chemical in the rivers to kill the young stages of the flies. So we kept on monitoring over time. That's how we get to know that certain focus areas no longer transmit the disease.